Everyone, I'm Keuri, a third year physiotherapist, and today's my topic is physiotherapy in mental health, in public health, and community medicine. So, what is how physiotherapy helps in recovering the mental health? So, first of all, mental health and physical health are interdependent. WHO defines mental health as the ability to cope with stress, work, productivity, and contribute to community. Poor physical health exacerbates mental health and vice versa. So, physiotherapists operate within the biosocial model, sitting at the intersection of body and mind, uniquely positioned to support whole personal care. So now what research says, what is the evidence based? So systemic scoping review of 103rd articles, 70% used CBT, that is cognitive behavioral therapy informed approaches, 40% used graded exercise, and 41% focused on chronic low back pain. Physiotherapy is already integral to mental health care. Mental health informed approaches are predominantly delivered in outpatient settings. So now how physiotherapy helps, what techniques we can use to recover the mental health of the patient. So first of all, techniques like aerobic exercise, resistance training, progressive muscle relaxation, coordination and balance work, body awareness, and even dance therapy positively influence functional capacity and mental well-being. So these are the things we do for physical therapy, and we can do for recovery of mental health of the patient also. So physical exercise specifically helps prevent the onset of mental health problems, has an antidepressant effect, improves adherence to treatment and supervised by a physiotherapist, and boosts quality of life and self-esteem. So when we prescribe an exercise program, we are not just rebuilding strength, we are also supporting mood, motivation and resilience, which is the major part of the mental health. A real case study of a 33-year-old woman with an intellectual disability presented with anxiety that triggered breathing dysfunction leading to dizziness, current falls, and ultimately a wrist fracture. Her case illustrated the anxiety physical health cascade, which is very similar to having a bad physical coordination and mental health issues also. Unmanaged anxiety created a cycle of physical deterioration that further worsened her mental state. As always, we said earlier, mental health and physical health are correlated. So, as her anxiety is a part of her mental health, her physical health also affected, and she fractured her wrist. Now, what they did with her physiotherapy plan, breathing pacing techniques to interrupt the anxiety cycles, first of all they did. Then they did wrist rehab for of post fracture, then balance and strength training to restore confidence and stability. What was the outcome after 2 months? No further falls, confident independent mobility, and notably improved mood, demonstrating physiotherapy's powerful biosocial impact. So at the end, what is our role in the bigger picture? Physiotherapy within interdisciplinary mental health care. Physiotherapists are catalysts for behavioral change. As we saw in case study also, empowering patients through movement, education, and symptom management strategies, working alongside psychology, occupational therapy, and psychiatry, contributing movement and education as unique tools, not replacing mental health professionals. So basically, we can work with other healthcare professionals, supporting them and their professional throughout the therapy can do wonders for the patient, especially for mental health, people with mental health. At the end, physiotherapy changes the behavior as well as the mind. So, to conclude, treating the body is treating the mind. Recognizing the mind body link is essential for whole person care. Every exercise, breathing technique, and balance session delivered by physiotherapy is not merely a physical intervention, it is simultaneously a mental health intervention. This perspective reframes how we understand the scope and impact of physiotherapy practice. Physiotherapy's unique contribution lies in its ability to address physical symptoms while simultaneously supporting psychological well-being. By embracing the biosocial model, physiotherapy become integral partners in comprehensive person-centered care. This mind-body unity is not a new concept, it is very foundation of what it means to treat the whole person, especially in physiotherapy. These are the references. Thank you.